Well, I've been part of BASE for 6 years. I've been a member of the board of directors for my time on building A Safer Evansville. A number of years ago, we did a community assessment and we noticed that there was a problem with diversion of prescription medications in our community. And we tried to come up with some ways to combat that problem that we knew we had. We were seeing problems at open houses and hearing about problems at open houses of medications getting stolen, people not knowing where to drop off medications and use medications, throwing them in the trash or leaving them out, and their grandkids or their children were getting a hold of them. And we knew that there was a problem in our community, so we started this program here at Evansville with Building a Safer Evansville to combat the problem with the diversion of prescription medications.
BASE uses CADCO's Strategic Prevention Framework model to analyze all of the problems in our community. After completing a full community assessment, which included focus groups with teens, parents, and local business leaders, key leader interviews with local leaders in our community, and gathering data from local police departments, from hospitals, and getting county data as well, we realized our main focus and one of our main problems was the diversion of medications from homes and businesses. And part of the reason for this was twofold. We learned that it was because people weren't disposing of their medications in a timely manner, because they thought maybe they'd be able to use them again and then they wouldn't have to pay for them again. And they also weren't locking their medications up. They didn't realize the importance of that. So they were being diverted by children, grandchildren, and sometimes even strangers from their home. So we needed to assess what partners we needed and what partners we already had at the table and what we could do to affect this problem. We did that, and then we created a plan.
Back in 2010, I was approached about starting a group to address some of the substance and mental health issues here in Evansville. There wasn't really a plan at the time. We just wanted to get together and start talking about it. We'd had several student suicides, and it was clear that something had to be done. Out of those efforts and collaborations, we've built BASE. It started out as a few concerned citizens, and over the years we've rolled in the police department, the school, city government, and many, many more organizations here in the city.
We've taken in so many unwanted prescription medications that we needed a place that was secure in our organization to store these prescription drugs. We've taken over 2,700 pounds of prescription medications in our drug drop-off facility, which then get transferred into this secure cage until we meet up every 6 months after the take-back days at our local centralized countywide center, where we take the boxes of drugs, then they get turned over to the Department of Justice in Madison, Wisconsin for destruction.
Part of this plan included partnering with key partners and sectors within the Evansville community. This included the police department, the fire and EMS, local funeral homes, the school district, Creekside Place, which is our local senior center, realtor, healthcare offices, Section 8 housing, as well as local employees and employers. All of these agencies and businesses agreed to policy changes involving medication use and also agreed to hand out free medication lockboxes. Since 2014, over 250 medication lockboxes has been handed out through these sectors to Evansville community members.
From what essentially started as a group of 5 people, talk has transformed into action. We knew we needed a hit right away. So the very first thing we did was to put in the drug collection box at the police department. We knew it was something that we could do without a whole lot of red tape and something that would be well received in the community. And just this last year, we've gone over the milestone. We've collected more than a ton unwanted, outdated medication and sent it to be properly destroyed. So that's just a few of the ways that BASE has had an impact here in Evansville. I'm proud to have been a part of it.
I am so proud of how the Evansville community and our coalition has come together to combat medication misuse and abuse in Evansville. The prescription medication diversion program, prevention program that the coalition has put together has seen results. We have seen an increase in community members properly disposing and locking up their medications. We've seen a decrease in the 30-day use rate of prescription medications by high schoolers and middle schoolers. And in 2011, when we conducted focus groups, one of the main topics of concern was medication misuse and abuse. In 2016, when we redid this focus groups, it wasn't seen as a problem. Everything the coalition has been doing has worked. This innovative program that we've created has created results for our community.